Awesome. Okay, I think we'll make a start. All right, welcome everyone. Very nice to have you joining us here today. I'm really delighted to have this opportunity to welcome our very, I think, intensive collaborator, Imran Matin, who's joining us from BRAC Institute for Governance and Development. And we're really delighted that you can be here today because IDS and BIGD have a very long and growing relationship. Personally, I'm also delighted because I've been engaged with BIGD actually since it became BIGD. But when I worked previously with the International Development Research Centre through the Think Tank Initiative, and I really appreciated how much BIGD's work is not only engaging some of the most critical societal agendas in Bangladesh, but growing the depth and extending the range of the research and engaging extremely effectively with not only government, but a whole range of societal actors, including, of course, civil society. I think it's a really great model of how an institute can engage through research, speaks very closely to IDS's own strong interest in engaged excellence. So we're here to have the opportunity for this particular part of our afternoon to engage with you. Imran, you're going to talk about disrupted recovery and distressed resilience, the 18-month trend of COVID impact. And part of this work I know is connected through collaboration that we've had through the COVID Collective, which is a platform that IDS coordinates, but now has many dozens of partners and projects working in many countries in the world. The BIGD has again been part of that collective right from the outset. And also we'll be talking later as well about another program which is CLEAR, which is the initiative which is coordinated by the FCDO mission in Bangladesh, and which BIGD again is a partner with IDS, in which Sohela and I are also closely involved with a number of other partners as well. So basically lots of collaboration, lots of engagement, and we're really delighted to have you here, not only for this talk this afternoon, but also for some conversations afterwards about our ongoing collaboration. So we're going to hear from Imran in a minute. I'm going to ask my co-host, Sohela, to introduce you, Imran, just briefly, and then also to say that when Imran has finished his presentation, there'll be an opportunity for Q&A and for a discussion as well.
Thank you, Peter. I don't think Imran needs a lot of introduction. I mean, in the sense that Sussex people know him very well from his student days. So Imran is the executive director right now of BIGD, BRAC University. But before that, he was also the director of research for the Research and Evaluation Division of BRAC. And then he moved to Save the Children International as the International Programs Director. And then he moved to IPA as the Chief Research and Policy Officer of Innovations. So you can see he has had a varied and sort of interesting career trajectory. And BIGD has been doing exciting work, as you have heard from Peter, on impact of COVID, particularly the livelihoods survey, which has been very interesting for us to collaborate on. So without much further ado, Imran, you have about a little less than 30 minutes. It's a tight time frame, and then we'll open up for Q&A. So Imran.
Thank you. Am I audible? I'm audible. Thank you very much for the very kind introduction. It's always great to be back at Sussex, and in particular IDS, there's so much memory and history that I have with the university and IDS, of course. So it's great to be back here. Great. So what I'm going to be doing is really talking about the work, drawing from the research that we've been doing in partnership with PPRC, and we have done 4 rounds of surveys, and I will be basically drawing on that. Now, I haven't really, I'm just a messenger here and trying to tell the story and just taking advantage of my presence here. But this work has been done by a team of researchers at BIGD and PPRC over the last 18 months, 4 rounds of surveys. And as you can see here, this is the 4 rounds of surveys we have done. We responded right after the first lockdown, so we can look at really early impact. We also looked at, the kind of more longer term effects of the lockdown during the second round effect, the second round survey we did. And then we did a recovery effect, in sort of March 2021. And again, just after the second lockdown that happened, we did another survey. So I'm going to be drawing on primarily, all these 4 surveys to tell a 18-month-long story of, what is the PPRC BIGD panel finding out fast. Okay, so I'll basically, kind of provide a few, kind of very high level stylized, findings that is basically emerging from our work. So one is, the first is the urban disadvantage, right? I mean, as you can see, pre-COVID, we basically, this is the general pattern, right? Urban slum average income would generally be higher than rural average income. And that is exactly what drives, a particular phase in development in terms of rural to urban migration and conglomeration effect in the urban areas and so on and so forth. And that is the stage of, that is the general picture of development. Now, what COVID has done over time, as you can see by August 2021, the urban slum income has fallen below the rural average income, right? So I think this reversal, this urban disadvantage is extremely clear. And this started off from the first effect that we basically see in June, where the urban slum effect has been much steeper. Recovery from June to March has been slower. And then the second round effect that we see in, during the second lockdown has also been steeper again. For the urban poor living in urban slum areas. So that's the first, I think, point. And this is quite important in terms of longer term developmental phenomena or development trajectory. And this is the wrong type of reversals that we are seeing. The second, oops, where does it stuck? I can't get to the next slide. Is it stuck? I can go there and move the slide. Yeah. Would that be? Oh. I'm going to stop sharing and I'll share again. Okay, all right, great. Sorry for the technical glitch. Let's try. Okay. So this is the second thing that we basically see is the wrong type of convergence. So again, look at the distribution of average income across different, poverty groups, if you like, pre-COVID. And, that's the type of typical distribution that one basically sees. Non-poor average to be much higher. Then you have a clustering among the vulnerable non-poor, moderate poor, extreme poor, but that's how it basically usually, that's the general pattern. What we see, what COVID has basically done is collapsed all of that. And it's a wrong type of collapse. It's a collapse where the non-poor and vulnerable non-poor income has really dropped. And sort of moderate poor, extreme poor, relatively, kind of less drop, but the fact that non-poor and particularly vulnerable non-poor drop has been very high, which basically leads to a collapsing of all the, average income across the poverty group, which is the wrong type of convergence. That is not the type of convergence that we would like to see. So this is the other, I think, trend that we basically see. The third is vulnerable shifts. And this is an occupational transition matrix. So we looked at, our sample households or respondents, basically respondents' occupation pre-COVID and August 2021 occupation. And there are a lot of things here, but particularly I want to draw attention to the skill labor which you basically see, I mean, if you see across the diagonal, with, I mean, that is where the stability is, right? In terms of they're in the same sector, and you see the stability is sort of actually quite low, right? You basically see, you know, from 35% to maximum 67% that you basically see the stability. But skilled labor in particular, you know, you see the stability to be the lowest among skilled labor, moving to unskilled labor. Right, and I think this type of vulnerable shift is how, which lies at the heart of what we call distressed resilience. Okay, next, it got stuck again. Sorry. Okay. Then we look at gendered gap in income, and this is you know, looking at you know, so what we have a very neat you know, kind of a panel data. So actually what we have, we drew the panel data from a larger survey we did, a face-to-face survey back in 2017-18. And so we have got data point for 2017-18. We have a pre-COVID recall data that we basically ask people on. And then we have got another 3 rounds of data. So we basically actually have 5 rounds of data, 2 rounds being actually pre-COVID, right? So one is 2017-18, around that time, another just pre-COVID, which is a recall. So we can project, in some ways, we can predict what income may have been. So we can actually create a kind of a counterfactual in terms of what income could have been of these households, controlling for lots of other characteristics of these households, what income could have been if COVID had not hit. Now, this is not the most rigorous counterfactual, but it is, I think, pretty good. And what we see from there, and that allows us to look at the predicted income. And here, we see how predicted income for female respondents who were in labor force is the most affected, and particularly urban female. And so rural and urban, but urban female much higher. And what is interesting is you basically don't see a rural-urban difference in terms of predicted income fall for male respondents, but you do see a 10 percentage point difference in terms of the income fall, predicted income fall among urban, urban slum female workers compared to rural. Right now, you know, we can get into discussion what this really means and what type of interventions may actually be needed to, you know, kind of address this. Okay, food expenditure. We see, again, stalled food expenditure, and this obviously has got important implications for long, you know, kind of progress that we had been seeing previously in terms of nutrition, right? So food expenditure, which was gradually increasing from June to March, the recovery period has stalled again. So, and it is nowhere close to the food expenditure level pre-COVID, and this is, of course, of concern. Growing food, non-food expenditure. Now, this is really important driver of what we will talk later in terms of urban to rural migration. So what we basically see is there is a growing non-food expenditure, particularly in urban slum areas, ranging from house rent to utility costs, to medical costs, transportation, utility costs as well. So overall non-food expenditure has almost doubled on average for urban slum dwellers. And underlying this growing non-food expenditure is, of course, a range of non-responsive governance measures during this time, which failed to provide any kind of relief and left totally in the hands of private you know, incentives. This has obviously led to a growing burden for poor urban slum dwellers. Relief. So this is looking at percentage of households who reported getting some kind of relief support during the COVID, during the lockdown period. And what we see is generally has been higher in the urban slum, which I think is generally, is quite quite good, because it basically, despite the fact that in the urban slum areas, there was no social protection infrastructure, because social protection infrastructure generally has not covered urban slum. Even then, there was actually a big push to provide more of the relief in the urban slum areas compared to rural areas. And given that urban slum has been much more affected, which we saw before, I think this particular I think trend is good, but average value, average amount of this relief has been very, very tokenistic. I don't have figures on that here, but they've been really, really low. But what we also see is that compared to the first lockdown and second lockdown, we see a decline in the incidence of sort of households who got any relief support. So this has all meant that coping, and this is again, we are comparing how households cope between the first lockdown period and the second lockdown period, and you can see that what we basically see here is that there is a weakened coping. There's a much savings depletion has happened, so we can see that very, very clearly. More reliance on loan, shopkeeper, and help from friends and relatives. That's basically going on. But in terms of savings, there is clearly a savings depletion and a shift towards taking more debt. Now, we're not saying that these are kind of bad debt or good debt. I mean, we need more nuanced analysis and sort of service to look at that. But we do see that you can see here growing debt, and this is just showing that from the coping, we asked question about debt burden, and we looked at percentage of annual income, and it's sort of very, very clear that it is over time from February to August 2021, there is a growing debt phenomena that we see here. And this debt is being now taken from multiple sources. And this is generally the pattern, but it is a bit worrying to basically see the growth in kind of 11% of the kind of debt report, and this is always underreported, we know, but 11% is from moneylenders. Shopkeepers tend to be, these are short-term loan, but if you cannot repay, this can also get pretty nasty. And then NGOs have picked up, but again, less so in the urban area compared to rural. But the kind of the importance of bank in terms of kind of providing kind of any type of financial access is sort of very, very poor, particularly in the urban slum, but also in sort of rural areas as well. And this is the channel that has been used by the government primarily to support the small medium enterprise sector, which basically then leaves open the question to what extent SME sector have actually been sort of kind of supported, given the kind of report we basically see here. Okay, now we're getting into implication, right? And the implication, coping, we're moving into coping, and it is not hugely surprising that we also see a growth in terms of school-going children being engaged in different income earning activities. We have I don't show it here, but we have some results also from education, and we also see a big risk of learning loss that is basically emerging, especially among secondary school boys. And that, I think, ties in very much with this particular trend that we see in terms of school-going children being engaged in income generating activity. And this is also leading to reverse migration. Now, migration generally happens from rural to urban areas. We saw before, urban slum wage, average income is now actually lower than rural average income. No wonder we basically see, and given the non-food expenditure burden in the urban slum areas, we actually see, kind of emergence of a kind of a reverse migration that is happening. 28% migrated during this 18-month period, 10% have stayed back, or, even after 18 months. So this seems to be pretty sticky type of a reverse migration that is sort of happening. At least that's the story we get over the 18 months. Okay, now again, I got stuck. Okay. So what we basically see is that the big impact seems to have happened for the vulnerable non-poor. So these are households who are above the poverty line, but below the median national income, right? So this is the vulnerable non-poor, and this is the group where we basically, even in the first slide which I showed, that is where you see quite a steep, kind of decline in terms of average income. And we looked at, so this is what we call the new poor. These are poor who were non-poor before, who were vulnerable non-poor, above the poverty line, below the median income, and who have basically fallen into poverty. From our survey, we use that estimate then to blow up at the national level to look at new poor as a percentage of overall population, full population. Now, this is not to say that you add with the poverty line, of about 21-22%, you add another 21% or 19% and say that is the poverty rate. No, that is not what we are saying. We are saying that there have been 19.5% are newly poor. That doesn't mean that some people have escaped poverty during this time as well. So one is to look at overall poverty dynamics, then to look at what the actual rate of sort of headcount rate of poverty is right now. But right now, what we're seeing, about 19.5% new people who were not poor before, pre-COVID, who were not poor, are now below the poverty line, right? Which was 21%, just after COVID, which declined to about 14%, when the recovery was happening. And after the second lockdown, we basically see that shooting up again. So what we basically see is that even with, kind of very limited lockdown, the economy, the sort of effect of those lockdowns is becoming very, very cumulative right now, right? So I think it's really important in terms of policy, in terms of how we balance the kind of life and when you sort of look at the whole lockdown, kind of strategy, because the impact of that is actually quite severe. Now, this is what I think, what our data allows us to do, because we have panel data, so we can actually look at poverty dynamics. So what we do here is we look at only the vulnerable non-poor. So these are households who were not poor before, who have fallen into poverty. And then we look at, of those who were vulnerable non-poor before COVID, what has happened to them over time, right? So if you look at the total figure here, what we basically see, 8% were vulnerable above the poverty line before COVID, remain to be above the poverty line throughout this 4-round data, period that we have. 35% are usually poor. That means that they were non-poor pre-COVID. All the 3 rounds of surveys that we did, they were below the poverty line, right? So 35% in some ways are, we can say that this is getting into, more longer term, maybe structural poverty, or more chronic nature. Whereas 56% have been moving in and out. So this is what we might call the churning or occasional poor, which itself is a very vulnerable category, right? Now, if you break that down into rural and urban slum, what we see is that the more chronic poor, if you like, is primarily an urban slum phenomena. There's 27% of them, of the total vulnerable non-poor who are in the rural area who are chronically poor, whereas in the urban slum, it is almost twice the size, kind of from the rural. So again, I think the importance of the urban, the impact of COVID being more urban in nature, I think becomes very, very clear. We also asked people about, our respondents, about what the priority concerns are. And we've been asking this, in the last survey, we asked this, and we basically see this wouldn't come as, kind of huge surprise, but just want to highlight, things like food inflation, which is now, right now, in Bangladesh, this is becoming a major issue, with the sort of, kind of hike in gas and petroleum and all that. I mean, this is really becoming a huge issue, which is already what was beginning. Healthcare availability was also becoming, so I think the non-COVID related healthcare issues were emerging to be an issue. Vaccination, again, this was, and marriage of children and educational expenses was sort of children's education expense and marriage of children were increasingly becoming important concerns. So 5 highlights for me to end. So first is there's a disrupted recovery, right? So what we see is that the recovery was fragile, but the second lockdown is, kind of has underscored the continuing threat and reality of disruptions in the recovery process. So this is really important in terms of how we manage, because, any future infection threats that basically come, because and that basically means that we really, even short-term lockdowns do have huge impact. So I think, managing this in a more integrated way is going to be really important in terms of our overall recovery strategy. We see transient poverty or emerging poverty trap. I think, one of the arguments have been that, this new poor is a transient phenomena. What we see with our panel data, that is the case, but there's also a growing emergence of poverty trap as well. And I think the kind of intervention that one needs to think about in terms of the poverty trap and the transient poverty, those two categories would have to be, the kind of intervention strategy have to be much more nuanced in terms of how one sort of deals with these two different types of poverty, the poverty trap and the more transient poverty. We see distress resilience, and this is underpinning this distress resilience is unfair bargain. It is primarily where, people have been left to fend for themselves. There's been, absolutely, there's been some safety net, very tokenistic, been some good things that has been more urban in nature, but, overall has been very, very tokenistic. There has not been any reining in terms of the non-food expenditure, which has been really, really, kind of biting for the urban poor. And the overall bargain is very, very unfair, which has left poor people with vulnerable shifts in occupation, higher deployment of family labor, rising expenditure burden, eroding financial capacity, and almost very little social protection. So this, I think, is something that has become extremely clear, and sort of something that needs to be, I think, really taken very seriously. We see disproportionate impact on the urban poor. I don't want to talk more about that. I think that's been very, very clear. Finally, there's this new sociology of reverse migrants, right? So, this reverse migrants, how we deal with these reverse migrants who are now in the rural landscape, what type of interventions would be most effective for them, I think would be a kind of a new terrain of intervention thinking, but also of the new poor, not only the reverse migrant, but also the new poor, because the new poor have come from a different kind of aspiration, and different type of psychology, and the type of intervention that one could basically, need to think about in this, for this groups of people, both the reverse migrant and the new poor, I think would sort of require a new paradigm of thinking in terms of poverty alleviation program for government and NGOs, and sort of, I think, would challenge new knowledge generation as well. That's basically it for me. Thank you very much.
This is absolutely fascinating, and it's I think just having both a sense of the data and the interpretation, the analysis of that data is really interesting. I'm sure it's going to be to come forward in our room together in this small. Thank you. If you do have a question, you're welcome to use the microphone to ask it. Let's open up online. So. We do have some questions starting to come in as well, and maybe I can just preface one, Imran, just while we're gathering a few. You've really highlighted some waves of sort of transitions in Bangladesh, particularly which have been connected to lockdowns and some of the mitigation measures, which clearly are having probably a worse impact than the pandemic itself in some respects. Now, in Europe currently, we may see it also in the UK before long. The pandemic keeps evolving, it keeps changing. We're seeing in a number of continental European countries now new measures for lockdowns, increased citizen unrest and protest and dissatisfaction and uncertainty, basically, about which directions things are moving. If you could sort of continue to extrapolate some of your graphs and trends that you've shown, do you see a continuation based on the intelligence that you have at the moment of these kinds of trends continuing or worsening, or what's your sense of the outlook, even though I appreciate uncertainty characterizes all of this?
Well, I mean, if it just goes by the data, during the period when sort of recovery, so two facts there. So I think it was very clear that recovery was happening, but recovery was very, very fragile, right? So that gives hope that actually, if there were interventions primarily, kind of focusing on the kind of the small, medium, economy, it would have been able to kind of recover even faster, right? So I think recovery was happening despite the fact that the support to small, medium enterprise was actually not working very well. I mean, the government did have allocations, but those were primarily through banks, and they were not particularly well designed. So the last mile delivery challenge is really the most important issue here, I think. So it is not one of intent, but it is one of really taking the last mile delivery challenge very seriously. And Bangladesh is very fortunate to have, pretty strong multi-actor oriented strength, at the grassroots level, to be able to really, come up with very innovative ways to solve some of these last mile delivery sort of challenges. So I think at least in the context of Bangladesh, I'm hopeful that if we can really focus our minds in terms of seriously solving the last mile delivery challenges without papering over and sort of rhetorics around it, I think the kind of resilient spirit of the people, the fact that we are a densely populated economy with highly networked, kind of sort of economy, highly leveraged as well. I think we would be able to actually, really sort of recover much more meaningfully.
Okay, well, it's good to have that hopeful possibility. Obviously, an aspiration which is associated with a number of things being in place to facilitate that. We've got a question from our colleague Emily Wilson, who said, "Fascinating presentation, thank you. Could you explain what you mean by higher deployment of family labor? And does this refer to children having to work?"
So I think it's both. So one is I think, children, and we saw, I mean, that's also because schools have been closed. So that has also led to the risk of learning loss, and and also the sort of financial pressure of the household. So part of it is children, but part of it is also adult, men and women working in kind of inferior, kind of that kind of not de-skilling, but the more vulnerable shifts, and they're putting in longer hours. We actually have some data sort of suggesting that as well. But what is interesting is, so this is where I think what is happening within the household in terms of household chores and all that, because, in this type of a situation, one would almost assume that there would be a greater impetus for women to go, kind of participate in the labor market. What we see is completely opposite. And whether this is a transient phenomena or a more long-term phenomena, what is happening within the intra-household allocation of labor and bargaining within the household, whether and these are primarily not the poorest segment of the of the economy. These are more vulnerable non-poor households who have fallen into poverty. So I think this gendered sort of dynamics of work within the household and the choices being made, there is something we need to understand more. And I think this is some of this has got to do with the fact that we're dealing with a new demographic, which is a vulnerable non-poor who have fallen into poverty, rather than chronically poor, whose choices we understand a bit more.
Just to encourage other questions and comments to come through. And James, would you like to step up to the microphone? It's so that everyone online can hear your question. That's the reason for it.
Thanks, Imran. That was really interesting. The thing that really jumped out for me was the disproportionate impact on the urban population. And it's interesting because it's a pattern that's being observed in household surveys in many different parts of the world. There's a study we were just looking at the other day in Latin America, where they were looking at exactly the same kind of reversal of fortunes between urban and rural populations. And my question is, do you think that is a challenge for policy actors in responding to the crisis? Is this something which perhaps is unexpected or has been is misunderstood? Is there something that needs to be done to respond to that pattern of urban communities being hit the hardest by COVID, directly and indirectly? Thank you.
Yeah, so I think, I mean, even before COVID, at least in Bangladesh, urban poverty reduction has stalled, right? So urban poverty reduction, progress in urban poverty reduction has been far slower than progress in rural poverty reduction, right? Overall poverty reduction has been slowing, but urban poverty reduction in particular has been stalling, right? And so there are some underlying maybe diseconomies of agglomeration or other types of effect that possibly was happening already in the urban economy, which again got, I think, far more accelerated with the COVID because of the, transportation. We can easily see, that would have a big effect. A lot of the urban informal economy where sectors where you needed more face-to-face tailoring and those type of vendor work and all that required, it's much more kind of where you need face-to-face interaction, that got affected really, really badly. So I think it's not, so given the sectoral composition in the urban area, I think it's not very unusual that we've had the effect. I think what is challenging here is again, going back to, I think we need a much more ambitious, thoughtful, real recovery strategy for the small and medium enterprise sector. I mean, that really is the heart of it. And I think that will actually, I think, kind of, be the main point here in terms of, kind of, shifting and sort of recalibrating the economy back.
Does anyone have a question? You're welcome to write it in the chat box or unmute yourself and ask it directly. If not, then I will use my chair's prerogative or co-chairs.
I have a question.
So Imran, in terms of women withdrawing from the labor force, I guess in developed countries, like there's a lot of talk about the Great Resignation. So not sort of the flexibility and other things that's offered, but women are withdrawing because of the double burden and not being able to manage that. So it would be interesting because it was falling anyway in South Asia, labor force participation, but this may have created a different kind of push to unpack that. So that was just one sort of comment. I'll hold on to my question because I saw a hand up and it was Aftab. So if you want to unmute yourself and ask the question.
Yes, thank you so much. I am just...
Aftab?
Yes, I am Aftabuzzaman Al Imran from Bangladesh. I am currently having my post-graduation at
we can't hear you. Do you want to type your question in the chat box?
Okay.
Technology at times is difficult. Well, while Aftab types his question or unmutes himself, my question for you is, you were talking about the small and medium enterprise support for that and the government sort of using the formal mechanisms. But as you pointed out, that Bangladesh actually has multi-actor channels and part of it is NGOs and other actors. Is it sort of that our thinking is still stuck in the usual poverty alleviation sort of mechanisms that we are used to and have been quite successful in that? And sort of the way we think about poverty and the way we could use it has not shifted? Or is there a reluctance from the state to engage with the non-state actors in a way because the relations have shifted from collaborative cooperation to a little bit of tension around rights and other issues, as we know in Bangladesh?
Yeah. So I think in terms of the kind of multi-actor, or taking advantage of the multi-actor strength that Bangladesh has. I think there are examples of that that has happened. I think the vaccination is one area where I think there's been very strong partnership, I think, between the health NGOs and the government, the community level. I think that has worked well. I think there's also some kind of a more of an aid-driven that what you call as a kind of a competitive collaborative space, which is now totally shifted, which basically has made it much more sort of government in a much more driver's seat in terms of driving some of this and choosing who to collaborate with and under what conditions. And that is obviously a challenge. But I also think there's a new spaces of collaboration that's basically opening up. They're much more local in nature, maybe politicized, maybe link up with certain political interest, but that's a very interesting space that's really opening up. And I think that we don't really understand that very well. So I think we think about shrinking, if I use that, shrinking civil society space. Again, we have a poverty of thinking in terms of what we think about civil society actors. I think that is really is changing in Bangladesh at the sort of local level. And I think we just need to understand that. And, and there are new, I think COVID has led to emergence of new types of energy and new types of actors in that space. And their relationship with the local state machinery is quite interesting. And I think they have carved out in many cases spaces to be effective during this period. So I think a new type of a community-based model of development that possibly is sort of emerging in Bangladesh with new types of local actors, which we need to understand much more.
Thanks for that. We have the question from Aftab. So what Aftab is saying is that he's from Bangladesh, he's a civil servant. And then during COVID crisis, government provided many incentives to people, including the amount that was close to 5,000 takas, right? So what he wants to know is how these incentives work, and is there any better way of sort of helping people out? So did you have any evidence in that in your data?
Yeah, so as I said, I mean, I think it was really good to see that despite the fact that in the urban area, there was no established social protection mechanisms, the government did prioritize that. And we need to understand that better, how that actually worked, despite the fact not having infrastructure. I know there was an open market sale system that happened, and there were also the mayor, the ward commissioners, and different low-income settlement community-based organizations, did work together in terms of providing kind of very effective, distribution of this of the support that was provided in the urban slum areas. So in terms of the better way to facilitate, I think we need to, I think our listing exercise, we need to, I think somehow, and again, this is where we need to get into a more multi-actor oriented strength that we need to take advantage of, and also advantage of technology, because, we need to have more responsive way in which we can actually create this list within a very short time, right? So there has to be a base list, but then when there's this type of crisis hit, how do we actually, kind of quickly, kind of include new vulnerable people that need support within this list very, very quickly. And I think this would require a combination of local government, kind of strength, with new community-based, strength that is emerging, and how to leverage that along with technology. So all of this three need to come together to create a much more responsive listing and targeting, of sort of people under different types of shocks. I think that would be, my thought here.
So you have the local government, the tech people, and sort of the new kind of civil society actors that you're talking about. So are there any one last burning question, or we are almost coming to an end? Anyone? If not, you can take this up, and BIGD has exciting reports on their website. So there you go. Imran, was the data disaggregated by religious affiliation?
We did not really. The sample was not done to really sort of say enough on the sort of religious affiliation, and I don't think we collected information on religious affiliation as a part of the survey. So no.
Emily, we are overwhelmingly Muslim, almost over 90% now in Bangladesh. So that data needs to be collected differently, more qualitatively, to get sort of the aspect as if there is discrimination happening.
Just on that, within BRAC University Center for Peace and Justice, I think they have been doing some work focused on these more groups that are not usually captured through this traditional kind of national representative surveys. So those, I think we will get a lot more from that strand of work.
Mm-hmm. So basically, Peter has final points to make, and then after that, we will bring this to a close. So again, check out the BIGD website.
Thank you.
Thanks, Sohaila. In fact, I have a final question, Imran, so I'm not entirely letting you off the hook just yet, but then we will draw to a close. I'm interested, I think the richness of your data is really shedding light on what is happening in the context of Bangladesh, and the COVID Collective as an initiative bringing together a number of partners, projects, and contexts is really highlighting what is actually happening in those contexts, and it's providing data with a range of different groups, different communities, and different perspectives, which is really what it's all about. There's obviously also interest. What can we draw in terms of lessons and insights that's from the local, let's say in this sense, for the global? What comes to your mind in terms of the insights and lessons that you're learning from the evidence and the analysis that you've done in Bangladesh, which might generate insights that globally we should be thinking about, certainly in terms of efforts to chart a different course forward from here?
Well, I mean, I think firstly there's a lot that is emerging from the work we're doing in Bangladesh, which I think is sort of quite consistent with the kind of results that that other people are getting. I mean, urban, the fact that there's a particular challenge in terms of women, youth. This is another. I mean, I did not present. We have a youth survey as well, which we did with some really interesting results there. And again, the intersectionality between urban youth and women. I mean, young urban women. I think this is particularly the intersectionality there is particularly vulnerable. And I think so I think that consistency is sort of there. I think the importance of reimagining social protection. That's another one that's really emerging. How do we really move from a social protection that is really focused, that seems to be obsessed with minimizing exclusion error, or also minimizing inclusion error, to one that really focuses much more on minimizing exclusion error, right? So moving towards a more of a universalist approach to social protection, I think this is another big area. Of course, I think that is emerging, and responsive sort of as well. So responsive, more universalist type of social protection mechanisms. I think with a focus on the urban, and this is also becoming very important, and not only poor, but also vulnerable non-poor. So this is the other category. A lot of the progress that we see in poverty reduction has been primarily this move from poverty to vulnerable non-poor, and most of whom have been churning around poverty line, if you look at poverty dynamics, right? That is the general story of many emerging economists talking about poverty reduction. So that reality needs a policy attention, because that is a trap that we can basically fall under, and that is becoming also very, very important.
Great, thanks, Imran. I just saw out of the corner of my eye a last quick question that came through from Mary Wickenden as well, mentioning that in the disability research team, we've done qualitative work with people with disabilities in Bangladesh on COVID impact. And we found, as in other countries, that they had their usual disadvantages exacerbated. Have you included disability data in your surveys?
Yes, not in this survey, but we have separate work we're doing around, COVID and sort of people with disabilities in Bangladesh, a qualitative research we're doing as a part of the PENDA program that we are part of.
Yeah.
So from that, hopefully we will get some sort of results. But in this survey, these were phone surveys, so we just had to be very focused in terms of, within half an hour, what type of information one could really collect.
Yeah. Okay. Brilliant. Imran, thank you so much.
Thank you.
Thank you to all our colleagues. We may have been a small group in number in this room, but actually online we had quite a large group. Thank you to all who joined. Thank you to Gary and our communications colleagues as well for enabling us to have this hybrid conversation, which always brings a few technical slight hitches, but all were overcome. And we really appreciate you coming in, sharing your thoughts with us today, Imran. Thanks very much indeed.
Thank you very much.
Thank you.
Thank you.